fabricated smiles and controlled gestures. Express your fears or sadness, don't try to act against them. Act against dangerous or bad situations instead, and irrational fear or depression will go away. Physical symptoms like shaking, crying, nausea, pain, what is often called sickness, can be no more than pathological emotional expressions. Unlike normal emotional expressions, symptoms appear not as a reaction to a perceived emotional state, but to a situation. People with such symptoms do not realize that these symptoms are in fact the result of their state of fear or depression, and rather think that they are provoked by events they perceive in the outside world, like dangers or bad situations. For example, when someone says, "I cry for little or no reason," or "there is nothing to cry about," a rational cause is assumed that makes people cry instead of their own emotions. People with symptoms also display avoidant or passive-aggressive behavior. They do not openly express their feelings, nor do they openly speak up about their thoughts, nor act what they think. They act out of their fears by deliberately avoiding or sabotaging unpleasant people or situations, and express their thoughts about someone or something through obstructionist, involuntary resistance or stubbornness, avoidant behavior, and passive resistance. Fabricated smiles and controlled gestures are falling in the same category of expressing what you think you should express instead of what you feel. Also, whereas people without symptoms act against bad or dangerous situations and not against their sadness or fears, people with symptoms try to act against their feelings, and naturally they fail in doing that, because feelings are not subject to the control of reason. So, if you are like, "I'm depressed, afraid, and I try to do something about it, the situation is bad and I'm sick," try instead, "I'm depressed or afraid, and I'm sick. The situation is bad and I try to do something about it." And we will soon be in a position that the situation is bad and I try to do something about it. So I'm not so depressed or afraid, and I'm not sick.